Good morning, everybody in the auditorium and all you watching it via video connection. I am Päivi Sillanauke, Permanent Secretary for Ministry of Social Affairs and Health. Warmly welcome to the evaluation of the Finnish health security. The Honourable State Secretary Paula Lehtomäki from the Prime Minister's Office will open this evaluation week. After her, Secretary General Vesa Valtonen, who is head of the Security Committee's Secretariat, will lead us to the Finnish comprehensive security model. Then we will hear introductions from the JEE team leads, Drs. Anders Tegnell and Nirmal Kandel, of the week's objectives. In the end of this morning session, me and my dear colleague, Permanent Secretary Jaana Huusukallio from the Ministry of Agriculture and Forestry will give the overview of the Finnish health system. We will make a video of this week to be sure we will not miss anything, so our camera crew will be following you during this week. I hope you will tweet very actively, the hashtag being FinJEE. Honourable State Secretary Paula Lehtomäki, please, the floor is yours to open the External Evaluation Week.
Ladies and gentlemen, warmly welcome to open joint external evaluation process on health security to one of the most happy countries of the world, at least according to the World Economic Forum surveys. So this is one of the happiest countries in the world, but if you don't see so many happy faces around you, that's just because it's Monday morning. But I'm sure it's getting better during the week. Finland is celebrating its 100th anniversary of independence this year. The topic of the centenary year is Together. Together as a topic is not just a slogan. It is the way we have prepared the centenary year. It is the way we want to celebrate our independence. But together is also the way we try to do things in this country together. As a small nation, we just can't afford to anything else but trying to join our forces. Therefore, I think it's more than appropriate that today we are gathered here together to assess how is Finland doing on health sector. Doing things together is also the principle of Agenda 2030, which is globally accepted agenda for sustainable development. As we know, the need to strengthen national capacity for health risks is one of the targets under Goal 3 of the agenda. In Finland, the government has adopted a comprehensive and concrete action plan for the national implementation of Agenda 2030. There are two main focus areas in the action plan: coal-free and resource-wise Finland and equal and competent Finland. So, for example, decreasing health differences between different demographic groups is one of the targets of national implementation of Agenda 2030. Ladies and gentlemen, we are living in a world of ever-increasing interdependencies. Therefore, it is necessary to assess and develop security in a comprehensive way and from the intersectoral perspective. To guarantee the security of our society, we have to take into account all sectors in society. In Finland's security strategy for society, we have defined vital functions to society and given responsibility to secure them in all situations. The role of business community and third sector is recognized as well. Mr. Vesa Valtonen, Secretary General of the Security Committee, will tell you more details about our comprehensive approach to security afterwards. Health security is an important element of our security strategy. Health security work is carried out from the point of view of overall safety and by all branches of government. In health security work, the authorities, business life and organizations are together preparing for biological, chemical, radiation and other cross-border threats. These threats can endanger the health of people and animals and can endanger even the security of the whole society. Therefore, national health security is the responsibility of the highest government level. Ladies and gentlemen, security in society builds on the arrangements made in normal conditions. This applies also to health sector. Preparedness to act on crisis situation depends on the actions we take in normal conditions. Receiving reliable information about the strengths and weaknesses of our health security system is essential for the further development. This information is needed now, when we are in normal conditions, if anything in today's work can be normal, for us to be better secured if something exceptional happens. The purpose of the joint external evaluation is to help the country to draw up a multi-sectoral plan for health security capacity building. The voluntary external assessment is neither an end product nor an inspection. It is the beginning of a process for capacity building grounded in the country's commitment to improve its capacity to prevent, detect, and respond to all threats. It is my great pleasure to welcome the external evaluation team here. I trust this evaluation can really contribute to our National Health Security Week, and I wish you all a successful, interesting week here in Finland. We are eager to hear about the findings later this week on Friday. Warmly welcome and have a nice starting session this morning and an enjoyable week here in Finland. Thank you.
Madam, ladies and gentlemen, my name is Vesa Valtonen, and as working as the Secretary General for the Security Committee, I'm very pleased to be here, having this opportunity to open up our Finnish concept for comprehensive security. I'm also very happy that joint external evaluation is here in Finland, giving us the opportunity to promote Finnish healthcare and collaboration of security actors within. My presentation addresses the following questions. What is Finnish concept for comprehensive security? What are the common principles, vital functions, threat models, strategic tasking, crisis management model, and some examples of implementation? The Finnish concept is about trust and collaboration among security actors. We take care of the society's vital functions together with relevant security actors. we choose to our team together, as Secretary Lehtomäki just told. Authorities, of course, are responsible for preparedness and readiness. They use business community services more and more nowadays. Agreements with the enterprises are extremely important. National Energy Supply Agency supports the collaboration. Voluntary organizations also play a significant role, especially in the latter phases of the crisis. For example, the case migration, Finnish Red Cross took care over 70% of refugee camps in 2015. We also want to involve citizens in our concept. People may participate through voluntary organizations, or at least take care of their own capabilities, hopefully minimum of 72 hours that spares the resources of the authorities. Then how we came up with this concept, very brief history review. 100 years of independence, the first decades were thinking that we have to manage ourselves, the phase of isolation, so to say. And the elections of the Second World War, we came up with the total defense concept, preparing for the worst case scenario. And as you very well know, after the beginning of this millennium, very much changed in our security environment, and Finland had its first strategy securing vital functions in 2003. I would say then we shifted towards the comprehensive security concept that we are now having. So the strategy is very important for guidelines for the whole society. We share these 7 vital functions, aim at the same vision. The mark here reflects the interdependency of these vital functions. So we have to collaborate in order to get things done. We share the same threat models. There is 13 of them plus 37 examples what can possibly happen in society level. That also reflects the global incidents, and we take care of also the individual side of threats. But this creates basis for risk assessment in every level. For example, in North Karelia Hospital could do their risk assessment with these 37 examples in these 13 scenarios. Strategic tasking is mostly for the ministries. There is altogether 49 strategic tasks which the minister sees that are important for preparedness. And this also gives guidelines for the resources should be concentrated in these tasks. There is just a few examples in this picture. We share the same crisis management model where the competent authority plays the crucial role. Most of the crises we can find the competent authority and the others are supporting. When the situation is unclear or so dynamic, we need to use intersectoral collaborative bodies such as Security Committee or preparedness chiefs in emergencies. And then try to find out who is now responsible, who should be supported, and so on. The crises are very dynamic nowadays, and they are challenging, especially by media. So we need to be very flexible in order to get the government the right information, trusted way. But the basics is very simple. Competent authority, others are supporting, also the business community and organizations. And this is in a nutshell what Security Committee does and other intersectoral collaborative bodies. We follow what happens in the security environment, changes, whether it's global or international or domestic. And also, at the bottom, the changes in the society. People are aging, there are, so to say, slow crises approaching. And in the middle, we are trying to have these mechanisms of preparedness and readiness updated. We share an annual report to the President and government where we follow up how this is in a big picture going on. And this is where we face now, due to complexity, some challenges. We need to get more and better analysis and more fast. How does it work then in real life, not only in strategies and reports? The Security Committee is our good practice, so to say, in the state level. In the middle, you may see the tasking. It is about coordinating the comprehensive security issues, preparedness, and so on, giving advice, and so on. But here is the same principle. The competent authority is responsible of bringing issues to this Security Committee. There are sitting all the ministries, permanent secretary or state secretary. There is also most important security organizations present: police, rescue department, border guard, customs, defense forces, and experts from Finnish Security Intelligence Services, Information, and EU Secretariat. Quite unique is that there is also representative of business community. CEO of the National Energy Supply Agency is a member. And even NGOs may participate by a representative. At the moment, the chairman of the Finnish Red Cross is the member of Security Committee. That makes it possible to have whole of the society perspective in order to make our preparedness better. This evaluation is a good example how it works. Ministry of Social Affairs and Health by Permanent Secretary Päivi Sillanauke brought up this joint external evaluation would be important, and the network of Security Committee could reach all the relevant actors in standing process. With mutual decision, we started the preparation with the preparedness chiefs and secretariat. Security Committee will monitor the outcome and, if needed, give suggestions in order to improve preparedness in health security, but also in other sectors. Then more near the real life. It's about regional collaboration. We are having a big reform concerning health, social service, and regional government, but many of the regions or counties are already using the process of comprehensive security. South Karelia has a security cluster which gathers together all the relevant security actors from that county. There is social and health in very significant role, of course, border guard, police, the states, cities of Lappeenranta and Imatra, other municipalities, rescue services, customs, chamber of commerce, army academy, and church, and other NGOs. And they share with regular meetings idea of a situational picture, plan together preparedness, and give suggestions to the resource owners, actually the city and ministries then, that what should be done in this area. Ladies and gentlemen, you may find these material, all our strategies, they are shared in our website. There is an English one and also Swedish if needed, and of course Finnish. But there is materials, and you may find all of our strategies and get some more information there. We are living in a complex world, and therefore implementation of the comprehensive security concept is sometimes challenging. Especially the interdependencies with local and global systems are challenging the standing operational concepts. We need to be able to collaborate fluently also in international context. Yet we are lucky to have competent authorities who are operating legally and efficiently, and they are supported with private and voluntary sector experts. Collaboration works through trust between the security actors, and building trust requires right mindset and lots of footwork. With these features, our concept works quite well. So we have a good reason to say that Finland is a safe and good country to live in. I wish the evaluators of the joint external evaluation most welcome. We are fortunate to have such a possibility to get analysis and advice from external professionals. This is a great chance to learn and develop our capabilities, not only in health security, but also for the concept as a whole. Thank you for your interest.
Slides, but I will. Yeah, I will just put this rotating there. So, okay, we have something on the screen. Okay. Thank you, and good morning to all of you. And a special thanks to the State Secretary Paula Leikki, the Permanent Secretary Päivi Sillamäki, and of course the Secretary General Vesa Valtonen for the warm welcome, and also for the, I think, very important basic information we have received so far. I think this gives us a first insight into the challenges and the things that we will find in the Finnish system. As you know, we have come here as the joint external evaluation team. My name is Anders Tegnell. I'm from the Public Health Agency in Sweden. And I'm joined by my colleague from WHO, Nimal Kandel, who is going to be the co-leader of this mission. And I know we are both very excited about being here and getting to know the Finnish system and to have good discussions around that. I would like to start with acknowledging, of course, the lead of Finland in this way, not only in putting together this very extensive and very good self-evaluation report so far, but also, of course, as a country that's been leading the process of the JEE all the way. And that, of course, means that it's a special privilege, but also a special challenge to be here and have this discussion with one of the founders of the system. And I think that's going to be very interesting. We are going to use, as you know, a peer-to-peer collaborative process. And we will use this to jointly assess the situation in Finland based on your report and these 19 technical areas that we're going through. And my colleague will go further into the detail of those 19 areas. We will, of course, follow the report, but there is also a multi-sectorial team I'm joined with here, and I'm sure that we can add experiences from other places and from our own experience to that. And out of that, develop both the scores in the different areas, but also priority things that can, even in Finland, where the system already is so well developed, maybe serve to make it even better. I really like the Finnish slogan for the 100 years, together. I think together is significant on many things that we are working with here. today. It's, of course, significant for Agenda 2030 in many ways. It's also significant for preparedness in general, as we heard already repeatedly, especially in small countries like Finland or like Sweden. This togetherness is very important. And I think together is also can be a good word for the joint evaluation exercises we do, because it's very much about doing this together. The team from several different countries and the Finnish team, and I'm really looking forward to taking that forward further. This exercise will assess the capacity in this country to prevent, detect, and not least rapidly respond to public health threats. And it doesn't matter if those are natural or deliberate or accidental. The system should be able to take care of them without any cause for that. And this is also, of course, the basic requirements of the IHR. Nirma will tell you more about the background to IHR, but this is the foundation and the platform where we can develop this togetherness I've been talking about. This process is a joint evaluation exercise. It's built on many similar exercises with peer reviews in many different areas. But I think it's unique in its way that it's really covering a very wide spectrum of different agencies, different departments, different ministries, and different stakeholders. And that's why it's evaluating, I think, countries in a new way. That's going to be very useful for all of us to do. And by now, the JEE also has a broad international support, which means that it also is a way of building a network, because we all know that health security is never going to be the challenge only for one country. It's always going to be the challenge for all of us together. And I think that's why it's also good that we have a team here from different countries, and all together these JEEs with the networks it forms will also form an important basis for networks we can use also in the time of crisis. The exercise will build on the very extensive and very thorough self-evaluation report that we received already, and we are very impressed with so far. And we will use that as a basis for going through these 19 different areas. And we all think that we can add things from our various experiences in the team, and that together will give us a basis for the scores, the additional areas that can be developed in Finland, and we can use those together to form a report. We will end this week on Friday and give you some basic ideas on where we see that things can be developed further. And we are sure that in a team we can develop a report and get it back to you within a few weeks after that as a first draft. But of course this is a challenge. This is a lot of things that we're going to need to go through. There is a few hundred pages of reports so far. And I hope that we can all get together and support each other in keeping the timeliness that we've done so far in this, because I think it's going to be a major challenge to get through all of this in the time we have allotted. But I'm sure with the help of our experienced team and with the help of our Finnish colleagues that we can arrive at that, and we can develop interesting discussions during this week and get together and give you a good report back on Friday and develop it further into written report. That I'm sure is going to be useful for Finland in the further development. We already heard that you are developing new plans and new structures in several different areas, and I'm sure this is going to be a good basis for that. Thank you very much.
Good morning, everybody, and distinguished, respected senior officials sitting in a dais. It's very good to be back in Finland. Why I'm telling back in Finland? Because last year, four of us sitting next to this room and developing, standardizing the JEE process. and how to streamline the process and make it uniform all over the world. So I'm equally excited to be back with our colleague who joined hand in hand to develop the joint external evaluation tool and the process. So briefly, I will take on how the JEE evolved and also the International Health Regulation and its monitoring and evaluation framework. So as you know that in 2005, revised International Health Regulation was adopted, and since 2007, June 15, it has been implemented. And every year since 2010 onwards, state parties, member states, were reporting to WHO under the Article 54 to report in the World Health Assembly. I have a good news. Over the period since 2010 till 2016, out of 196 countries, 195 countries have reported at least once, in an average of 70% of the countries reporting every year. So we have only one country who have not reported. I'm not going to name that country, but the good thing is there is a culture developed of self-reporting by the country, and they want to continue on it. However, there are some limitations of the self-evaluation, and IHR Review Committee recommendation on the second extension, as well as the Ebola IHR Review Committee has recommended that not to work only on the self-assessment, but also look at the other process of evaluation. So like external evaluation, peer-to-peer evaluation, after-action reviews, and exercise. Based on that, in 2015, we developed the concept of IHR Monitoring Evaluation Framework, comprising of 4 components: annual reporting, joint external evaluation, after-action review, and the exercises. This concept note was shared in every regional committees, and all regions endorse it and to move forward. Based on that, IHR Monitoring Evaluation Framework was developed. One of the components which got more attention is the joint external evaluation. So 2015, along with the partners, we worked together and developed the JEE tool, which was launched in February 2016. And Tanzania is the first country who did the first JEE, and Ethiopia and Pakistan. And so far, we have 33 countries which have already done the JEE. So Finland is the 34th country to do the JEE at this stage. So these are the 4 components based on the principle of transparency. So the example is we are publishing the reports. Member states are open to publish the report. I usually call it's a paradigm shift by the member states where countries were reluctant to have the external evaluation, but now they are requesting for the external evaluation as well as publishing the report. It depends on the mutual accountability, trust building among the member states, within the ministries, within the government. It appreciates on the public health benefits, carries continuous dialogue across the sectors, across the government, and across the country, and we want this as a sustainable approach. So this evaluation, based on the IHR Monitoring Evaluation Framework, it evolves around the process improvement approach. As you all know, we identify the gaps, we try to improve it, we manage it, and we regularly monitor it. So we need to have a mechanism that continuously we monitor and evaluate and continuously improve our process or the system. So this all IHR Monitoring Evaluation Framework lies on the process improvement approach. So let me go briefly on the overview of the JEE tool. As I mentioned earlier, that started since 2000. We actually published on February 22nd, 2016. It has 19 technical areas divided into the 4 groups: prevent, detect, response, other hazards. It evaluates the international health capacities for the health security to prevent, detect, and rapidly respond to public health threats, whether occurring naturally or due to deliberate or accidental use. This can be used for internal self-evaluation. A number of countries have already used it to develop their national action plan by doing only self-evaluations. So since then, as I mentioned, we have already evaluated 33 countries, and more countries are in pipeline. The core elements is to preventing and reducing the likelihoods of the outbreaks, detecting threats early to save lives, and rapid and effective response for all IHR-related hazards, not only biological, but also chemical, radiation, and food-related events as well. The use of the tool specifically helps on determining the baseline capacity, including gaps and needs, inform the development of the implementation plan. Now the momentum has already started that following JE countries have already started developing the country a national action plan for health security. Measure progress on work implemented across the ISR core capacities and highlights the gaps and needs for current and prospective donors. It applies to more on the low and middle income countries. However, this is the momentum it's moving onwards. So just many of you are very aware of the process, but just want to bring the highlight here. It's a different kind of evaluation because it's a voluntary and it's characterized by openness and transparency, peer-to-peer review, and fully collaborative process, includes multi-sectorality. We will be seeing all the sectors involved for the health security during this week also. We have a field visits to support and inform technical area discussions, integrates and support findings from other assessment. We have a big file with the self-assessment. And I often says that the JE evaluation, the good JE evaluation depends on the good self-evaluation report also. The countries who have done sound self-evaluation have a very good joint external evaluation also. Focus is on the development of priority actions, and as you know, we will be coming up with at least 3 to 5 priority actions, but we will not go more than 5. If there needs to be, then it will be incorporated as areas needs to be strengthened. Final report generally presented to host country, and we would like to have published very soon because it has to go some editorial process and clearance. But recently we have decided that executive summary and score will be published as soon as it is presented. So we will try to set example of publishing executive summary from the Finland also. And it engages broad donor and international support is on a common platform. As I mentioned, the final report will have a scores, strengths, areas which need strengthening, and top 3 to 5 priority actions. And evaluation results are now mostly published in WHO website, and it's open to all public. Based on this evaluation, we have a lot of encouraging statements. One is last World Health Assembly, government of Pakistan encouraging all the countries to go through the evaluation process. So this drives the momentum across the world to go for the joint external evaluation. The evaluation process has also been a learning experience for peers, for ourselves, for WHO, for international agencies, and partners. I have already mentioned 33 countries have already completed, and two countries have already done their national action plan. And then 8 countries are developing the national action plan, which we have the date. It is standard JE practice to have all evaluation reports publicly available in the website. So this is the map, which looks beautiful, with 33 countries already done and 29 in pipeline. There are countries who have expressed for the evaluation, but not had set the date, so we have not put them here in this slide. And most of you get this update every Friday. WHO sends out the weekly update of JE mission as well as country planning missions every Friday. Just to give you a few examples, the impact of the JE, I usually like the one from one of the provinces of in Pakistan, Balochistan, where the Provincial Director General of Animal Health said that this is a fantastic process. We are sitting first time together, and he did one immediate action that we have a lot of veterinarians. From next day, I'm sending 2 veterinarians to the provincial health office, and actually he did it also. So now they have the veterinarian sitting in the provincial health office already. So this is one of the good examples. Another example we heard in US JE mission with animal health colleagues and Ministry of Health colleagues referring that we thought that our coordination across sector was very good. But then we realized when doing the self-evaluation, there are a lot of areas we can improve. So this is the example and impact of the external evaluation and this self-evaluation and entire process. So this is just a summary of the presentation, may not apply directly for Finland, but one thing is this, there are a number of queries from a lot of low-income and middle-income countries, why the evaluation is only for low-income, why not for high-income? And US and Finland has set another example doing this one, which will motivate other countries to do. It's not only for low-income countries, but also for the high-income countries. This evaluation and the development of the plan, which will bring together for the technical support, the funding support, and the guidance from the partners, from the international agencies and peer-to-peer countries, overall to strengthen IHR capacity for the health security. A lot of work has been done in 2016 in order to standardize this process, and we collectively have a lot of supporting materials and guidance document. You can see those lists there. Some are published, some are drafts, some are about to publish, and these are available in the WHO website. To make the things easy for the subject matter experts, we have online orientation package also, which generates certificate also, as well as we conducted 2 team lead trainings. So the one who participated the team lead training will be leading this JE mission. So that's all. If you have any questions, we are happy to take during the week. Thank you.
Ladies and gentlemen, now it's time to go through the Finnish health system. And it's really a pleasure for me to show you here that we are doing this as a team with my dear colleague, Permanent Secretary Jaana Hursu-Kallio from Ministry of Agriculture and Forestry. So you can see and hear how we really plan and do things together. But as leaders quite often think and know when they have planned and learned something, it doesn't mean that the whole organization is running that way. So therefore, we still have work to do with my colleague to get also the new ideas we will get from you then into action. Some history first from Finland, an overview here. So we have a population that is only 5.5 million, and the density of people living here is not very high. So if you look this map, it's 1,100 kilometers from Helsinki to the northern part, and most of the people are living here in southern Finland. And when you hear our legislation, which is universal access, so it makes some challenges for us when planning health system here, so that we will be sure that everyone will have access to all the services, regardless where he or she lives. We are getting old, second fastest in the world after Japan, which also gives us challenges in the future. And the economy here, as you heard already from our Secretary of State, Paula Lehtomäki, that we are very happy people here. It doesn't mean that we don't have challenges. So the economical challenges is the burden of the official sector then to keep all the requirements and promises our politicians has promised to this population who is living here in Finland. About those regions and primary healthcare, then a little bit more in the in coming pictures. Something about our history. We have been part of Sweden and part of Russia, and we have culture from both sides of our neighbors. And we do a lot of cooperation inside Scandinavia, and our politicians and presidents also has been talking that we should do it more in the future, even more, because we are small countries here, and we share a lot of principles, same principles in our legislation concerning public sector, but also rights for people and services for people who live here. Then a big challenge was also after World War II, when we resettled 400,000 citizens from Karelia. And if you think that we are only about 5 million people here, then so it meant a lot, and it was a big challenge. And it also influenced how we then developed our country. We got through rapid industrialization after 1950s, and there was a mass immigration in late 1960s and early 1970s to Sweden, which was already industrialized further than Finland. In the late 1970s, Finland reached the level of the OECD countries in GDP, and living of conditions and social security reached level that justified to call Finland as Nordic welfare state. And we now try to stay there. We got through a recession and deep banking crisis in early 1990s, but we kept our welfare state, regardless of that. And during that time, the healthcare costs were increasing, especially specialized healthcare costs, and that's why we are doing a reform now here in our country, and I will tell you some about that later. What about our welfare model? We have universal rights for health, we have strong social cohesion, equal access to services, and these are based on the legislation, also in constitution. It concerns the residents here, so it's resident-based system and taxation-based system. Governance is highly decentralized into municipalities, which we have more than 300, and that is one of the problems we have. This is my ministry. I have two ministers, one taking care of, should I say, the money, the social security and social benefits and pensions, and then the other one taking care of social and health services and family issues. We are a big ministry, and we have legislation and responsibilities from insurance legislation concerning all the insurance sectors. Then the pensions are especially our issue, and we go through to a promotion of welfare health, to the social and health services, and also to the occupational safety and health. So there are responsibilities according to working life, but also to whole social security and also those social and health services. Then we have a lot of institutions which gives us information and do studies and also supervision to the system in Finland. Current situation. We have over 300 municipalities, which are responsible for social and health services at the primary level. Then we have 20 hospital districts, which are responsible for specialized health care. So there are different organizations having responsibilities from these two. And now we are joining in our reform this. We have 5 specific catchment areas. We have 5 university hospitals, which then give under those 5 areas the most specialized care. And of course, because we are only 5.5 million people, there are care which is really centralized to 1 hospital or 2 hospitals also. There is supplementary private sector services, and in the reform we are now combining so that we will combine all the resources and make private sector and public sector producers equal. And also adding the freedom of choice to that. Social services are responsibility of municipalities, and they are joined there with primary health services quite well. Then we have 16 total municipality coalitions who then take care of specialized social services for people with developmental disabilities. The concern or remarks and concerns we now have that the system is too decentralized, steering by the government is weak, and primary healthcare and specialized healthcare are separate. And when the population is going old, we also need social services to be part of that thinking and organizing and planning. What are the good things we have is that municipalities have a legal obligation to promote health and well-being among the inhabitants, and the money which goes to the municipalities is not earmarked. So they really can do cross-sectoral work and innovations at the municipality level, and they have done a lot. So we have during these 20 years a lot of innovations about how to promote health, but because it's so decentralized, it's very hard to get the learning go through the whole country. Health threats in Finland have happened a lot during last 20 or 50 years. We have very low infant mortality. Our life expectancy is quite good, lower than in Sweden and in Norway, but a little bit higher than in Denmark. And Danish are very happy and they don't live so healthy, which also shows their life expectancy, and we try to merge those two here in Finland. But there is inequalities in morbidity and mortality still increasing, and there are inequalities more in our country between men and women than in many other countries. We have the lowest teenage pregnancy rates in the world. Communicable diseases are under control, and coronary heart diseases, which were a great burden to our country during 60s and 70s and 80s, has become more rare. Mental health problems are the main reasons for work disability, and alcohol-related causes of death are a main cause of death among working-age men and women. In our social and healthcare reform, we actually do a regional reform, which helps us, Jaana and me, to work then even better in the future, because under those 18 autonomous regions, there will be responsibility both from social health services, but also from agriculture and forestry and animal health and food issues, as you will hear later from Jaana's presentation. So, and there will also be other sectors included. So going from those over 300 municipalities, we go to 18 regions, which will help us. But it's very, very big change in our country because we have lived now nearly 400 years so that we have had a municipality level and governmental level. And now there comes a regional level in between, and it is a very sensitive political issue which doesn't help us to make through this reform. There will be 5 cooperative areas, but they won't be given big responsibility, so they are more like coordinating, and therefore we need more state steering for this system. Our aim is to guarantee equal access to services and then to reduce health inequalities, but we are trying to do now other kind of tools than we have done before. So there have been a very public sector owned system where the organizer and producer have been the same. But now we are dividing those. So the responsibility for organizing will be for the region, and then there will be more independent providers then, which are then transparently followed, that they would give a more client-oriented approach, and then by the information we will make the seamless patient and client pathways there. So it will need a lot of new information for government and regions there, but the system will then be more flexible, which then perhaps helps more, and we believe that it helps more those who really need a lot of services, like old people and chronic diseases. Here you see the picture where my colleague Jana will then continue. It shows the 18 new regions under which the responsibility of organizing and following up the efficiency and effectiveness of our system will then be. I won't go into deep into this picture, but if you need some more information, you will get it. There is a lot of that. Also, international evaluations of these principles we are now putting through. So thank you from my side, and now I give the floor to my colleague Jan.
Dr. Tegnell and the whole team, you're very warmly welcome also on behalf of the Ministry of Agriculture and Forestry to Helsinki and Finland, and I'm sure that it will be a very busy week for you and a lot of material to understand the system in Finland. And I'm just going briefly go through the material from our side. But to start the story and to show in a very concrete way how the One Health approach is living, because Päivi, my colleague, has chosen the room here in the House of the Estates. And if you look up there, you can easily see in which room you are. You are in the room of the farmers. So this is to show that the glue between us is of course linked to food and water, because they are one of the crucial things, of course, for the health and well-being of everyone also in this country. So the One Health aspect is something that I would say that one of the cornerstones of the approach of our cooperation today, and knowing quite well also the situation around the world, honestly, I'm proud of the situation in our country. It doesn't mean that there's no room for improvement, of course. As Päivi said, it's not only how well we talk between ourselves as colleagues or the two ministries, but it has to go through the whole chain on everyday basis. So I will start with the Food Safety Organization, and the legislation is coming through the Ministry of Agriculture and Forestry, and we have a very, so to say, good central agency, Finnish Food Safety Authority, with a very broad scope It started in 2006 when several organizations were merged. So to say that really from field to fork, from the forests and lakes to the plate of the consumers, this is now carried out with centralized instructions from one body. But the regional players also in this sector have been important for the state, and also the municipalities, including the laboratory work when we are talking about food testing, either microbiological tests or chemical tests. But I want to emphasize that this is not only a job of the Ministry of Agriculture and Forestry, but there is a very, very close contact, of course, with our sister ministries, not least with the Ministry of Social Affairs and Health, and the linkage, of course, to THOL, the Public Health Institute and the Medicine Agency, etc. But also when we are talking about residues, pesticides, and the control of chemicals, there we have a very close cooperation with the Ministry of Employment and the Economy. And from the Ministry of Finance side, we have, of course, and we need good cooperation with the customs. And the customs have traditionally had their own laboratory facilities in Finland. And also when we are talking about the soldiers, the younger and the older ones, they need to eat every day as well. So, of course, the Ministry of Defense and how to take care of the food safety issues is linked. So I tried to put all the players on one slide. But there's a lot of material available, starting from the European Union legislation and the demands that also are describing the situation, even from national planning on annual basis and multi-annual basis, how to take care of the food safety control in this country. But as you already heard, we have more than 300 municipalities, and the basic for food control and also for animal health and welfare has been the job of the local authorities. The animal health and welfare side by legal requirements have been a work coming from the state. And the state in a way has bought the job from the local authorities. But when we go in the area of food control, that has been by the legislation a job of the municipalities themselves. So we have a mixture of centralized and decentralized system. But today, it's not these more than 300 municipalities that do all the work. Step by step, we have increased the number increased the number of cooperation, so to say, but decreased the number of the units of the municipal authorities. And at the moment, there are 62 of them. So they do cooperate. So that they can specialize, they don't need to do all the jobs in each of the 313 municipalities. And I think that is important from the knowledge point of view and the expertise point of view, as the European Union and our national legislation is demanding, full of details. Not everyone is capable of doing all the work anymore. And I will come back to that with this reform that Päivi Sillanauke was already referring to. That is why we have been supportive for this regional change on national basis. And the regional state administrational agencies have specific duties also linked to animal health, animal welfare and epizootics, when they are in a way checking how the municipalities have been working. And the same is the issue for food control. So to say, more systematic control approach, whether the municipalities have been able to carry out their own job. That has been controlled regionally. And that is the basis for our future as well. There are specific areas which are totally centralized, like meat inspection. So the central body, EVIRA, Finnish Food Safety Authority, is responsible for this work. And there are details where the work is divided between the municipal authorities and EVIRA based on the possibilities by law to give this kind of authority. But the supervision, the guidance is clearly centralized. Just for your information, some background information about how big the households are compared to some other countries. And as Päivi already said, it is also a challenge for this area that the number of inhabitants in Finland is small, but the country by geographic is big. So it also is a challenge for the resources and the cost-effective use of the resources as such. But of course, all of us, we decide how big the family as such is. And then I wanted to raise a few issues which I think are crucial for you to understand where the major emphasis of this country has been during not only years but decades. The good cooperation I was referring to between the veterinary side and the human doctor's side is clearly linked to microbial risks. And that is where we are very good at. This zoonotic cooperation is very fluent in this country, and it is not between the authorities, but we know the commitment of our food chain as well. So that is why the prevalence of certain bacteria like Salmonella and Campylobacter is very low compared to many other countries around the world, even within the European Union. And that is why we have, when we access the European Union, specific legislation, as our colleagues from Sweden, with whom we cooperated very nicely at that time, we have specific additional guarantees, for instance, when we import meat. And just by coincidence, last week, I'm sure everyone has been following the discussion about the Brazilian meats and how the situation is. One of the reasons perhaps why we have imported a little less of the meat is that it's more expensive to export it to countries where we have these additional requirements for Salmonella control. But this is not only about what legislation says and what the authorities say, but it's also about the commitment of the whole food chain, starting from the feed of the animals. We are extremely proud of these more than 1 million food hygiene proficiency exams. I think this is quite unique in the world. So we have demands legally that when you are working, you are a worker in an establishment, that you have to pass this exam. But it is quite in fashion today also for youngsters to get this kind of a card which shows that you know the basics about hygiene. And I think that this is something that could be a model for some other countries as well, to take it as a normal part of the life, to know and understand the basics of good food hygiene. Transparency is the word of today, clearly, and that is why we have this OIVA system, which you will know more if you go through the material, where the results of the food control inspections are publicly available at the entrance of the food premises, but also you can find the results of the latest inspections from the web pages. So the zoonotic situation in general is good. Of course, we have challenges, and when you check more, you find the areas where you have to improve the situation, like is the case with the human listeriosis. From the nature point of view, we have challenges for tick-borne diseases, Lyme's disease, and for these tick-borne encephalitis as well. But otherwise, I would say that from the vector side, also from the climate point of view, the situation in Finland is extremely good compared to the more southern countries. The parasitic situation, both in animals and humans, is very good, also partly due to our climate situation. But if you And when you find the places where more improvement is needed, and I'm sure that now when we will have this municipal level elections within 1 month, this indoor malt discussion will be on the agenda, how to get money to take better care of the inside air. And I know that this is the case in many other countries as well. Just the background material for you, I will not definitely go into details. The biggest problem during the past few years, even this year, has been norovirus, which is an easily spreading virus, of course, goes by when you shake hands if you don't wash your hands properly. And also from the food side, we have tried to teach in practice, the European Union, that you have to take good care of the water with which you water the berries or the vegetables, not to spread it via the good food to all the clients within Europe as well. Just shortly about the food recalls. So if something goes wrong, and every now and then something can go wrong, either technically or by a human error or even on purpose. And what I'm very proud of in this country is that there's definitely no attitude to hide if something goes wrong. So if there's a need for product withdrawal, this is published on the newspapers paid by the company itself. It is the duty of the company. And at the same time, it is also published, of course, by the Finnish Food Safety Authority. But this works very well indeed, because I think that the general attitude clearly is that if something has gone wrong, the best thing is to tell it the quicker than later. And therefore, I count on the system. And whether they are allergens, which can be life-threatening, it is a must that this thing works every single day. And then just a few words about the animal health situation, not only from the zoonotic point of view, which I already mentioned, but we have a very good reputation from the animal health point of view when we are talking about the most infectious animal diseases, and there are several reasons for that. The location here in the north being one of them, not too many farms compared to many others. We don't have a history of markets, so people don't go to markets to buy animals. They are sold from one place to another or via a slaughterhouse more and more today. And that is crystal clear that it helps to avoid the spreading of the diseases. And also the farmers, they know the risks linked to these infectious diseases, even when they are buying animals from abroad, knowing, that we are a member of the European Union. And that is clearly linked to the AMR, the antibiotics resistance system, which is of good level in our country. And the prudent use of antibiotics is an issue in this country. The veterinarians don't get benefit if they give medicines to the farmers. Antibiotics are used only based on diagnosis. Preventive use does not exist, and we have tried to be forerunners in this area for decades, also on European Union level. And the basic for this is, of course, the good animal husbandry, the good practices, but also that the animal health situation is good. And there we have, of course, the linkage to the animal welfare issue, and the state has taken this seriously, even in a way that, which I know is quite rare compared to many other countries, although these subsidy issues exist in all the European Union countries, but we also have integrated animal well-being subsidy system for our country, and it is covering quite well both the beef and pork areas. And for your information, I don't definitely go into details of this slide, but this is how we try to sell, of course, also Finnish food by telling the situation in our country, that the most serious animal diseases have either never existed in our country or they have been eradicated ages ago. Even the diseases that are of zoonotic nature and are still really clearly of great importance globally. And that is why we have always been eager to help and assist other countries in these challenges around the world. And as I already mentioned, for the animal welfare is clearly linked to the use of antibiotics, and that is why what I'm very, very extremely proud of, that Finland is definitely one of the rare countries where we can produce broiler chicken without using antibiotics at all. And that the only reason being that they are so well taken care of, and it starts from the feed, of course. And there are several indicators, so if you are interested, this will be available for you with the material we have provided, and will provide to you whatever you prefer to have. And of course, linked to these indicators, it is linked to the residues. And as all the other European Union countries and the countries that like to and want to export to European Union, you have to have a good system for the control of the residues, and these non-compliant numbers are impressive, and this is the work we keep going to do. And I once more want to assure that this is not only to say that it is the civil servants or the political leaders to say, but this has to start from the animal owners themselves. That is clear. And then, in the end, a few words about the administration that Päivi was already referring to. So indeed, as for the health care side, also for our area, there will be 18 autonomous regions, and these, in a summary, will be responsible for taking care of our area as well, starting from the veterinary public health services to food control and to feed control, to plant control and animal welfare issues. So the Finnish Food Safety Authority will retain most of its present duties, and then it's up to the autonomous regions to make the structure in their area. And as you saw from the very first slide of Päivi, the situation is very different there in the north, where there are not so many people and not so many farms either, but the services you have to have. And here in the south, the situation is of course different. But we are indeed confident that this will be running smoothly. And I have chosen you, as Päivi, you started, that the Finns are happy. So I want to show that also the piglets are happy, because by law we have forbidden to cut the tail of the pig. And I know that this is happening in many countries. The reason being that if the circumstances are not good enough, unfortunately the pigs and the piglets start to eat each other's tails. And that's why they cut them, which I think is not such a good thing. Therefore, I'm waving the tail of a Finnish piglet for you to say that not only the human being has to be happy, but to have this One Health approach, also the animals have to be happy. And it's our responsibility to take good care of them. So thank you very much, and take all the benefit of the time here, and I'm going to see you on Wednesday at least, I guess, during the dinner time, and whatever is needed from the Ministry of Agriculture and Forestry or Evira, please be free to ask. This is the transparent country and nothing to hide. Enjoy your stay. Thank you.
Ladies and gentlemen, the morning session and the opening of the Joint External Evaluation and External Evaluation Week is now nearly closed. Some words still, so I would like to say to you that whole Finland, the government, our organizations, our systems are at your service. So I enjoy your week and learn, but also give us openly every recommendations you feel that we should know. I wish you all the best here in Finland. The session is closed. Thank you.